you struggling with a gassy baby? In this video, I'm going to show you the best tips and tricks for bottle feeding your baby that will help them feel better and reduce their gas. 1. What are the common causes of gas in babies? The most common causes of gas in babies are swallowing air while bottle feeding and not properly burping the baby to release excess gas. Bottle feeding can cause a baby to swallow more air if the nipple they're using is set at too fast of a flow, or if they're drinking from an open bottle with no venting system. This extra air can make them uncomfortably gassy, and sometimes even lead to pain due to colic or reflux. To help remedy this, parents should always use bottles that have venting systems, and choose nipples that have adjustable flows so their child doesn't get overwhelmed by an excessive amount of milk too quickly. By controlling the amount of air coming through the nipple, fewer bubbles will be swallowed by your baby during feedings, resulting in less gas. Properly burping your child after each feeding is also essential for reducing gas buildup in their stomachs. Babies need time and opportunity after every meal for these trapped gases to escape so they don't become too uncomfortable throughout the day. 2. How can I tell if my baby is gassy? If your baby is gassy, you may notice signs such as discomfort and fussiness during or after a feeding. You might also see that they are arching their back, burping more than usual, or passing gas frequently. If your baby has trouble sleeping or gets cranky soon after eating, it could be a sign of gas buildup in the stomach. In any case, if you suspect there is an issue with excessive gas, consult your pediatrician for further advice on how to help relieve the problem. 3. Are there ways to reduce the amount of gas my baby has? Yes, there are several ways to reduce the amount of gas your baby has while bottle feeding. One way is to make sure you burp your baby after each feed so that any air bubbles that have been swallowed get released instead of staying in their stomach and causing discomfort. Another method is to try different bottles and nipples until you find one that works best for your baby. Some bottles can cause more air bubbles than others when your baby sucks on them. You can also experiment with keeping your baby's head more upright during feeding, as this will help prevent them from swallowing too much air. 4. How important is it to use proper bottle feeding techniques? It is extremely important to use proper bottle feeding techniques when feeding a baby. Incorrect technique can lead to several issues including improper digestion, gassiness, and discomfort for the baby. The proper technique ensures that the baby receives enough nutrition while minimizing gas and other digestive issues. Additionally, the proper bottle feeding technique reduces the risk of aspiration, which is when some of the formula or milk enters the lungs instead of the stomach. This can be a serious issue if not monitored closely. Therefore, it is essential to make sure you are using the correct bottle feeding techniques with your baby. 5. What should I look for when choosing a bottle for my baby? When selecting a bottle for your baby, look for one that is BPA-free, has an ergonomic design, and is dishwasher safe. Also, make sure to select the right size nipple for your baby's age and feeding preference. If you're having trouble with air bubbles in the milk during feedings, try using a bottle with a venting system. This allows the air to escape while preventing any of the milk from spilling out. 6. Are there any other tips for helping a gassy baby feel better during and after feeding time? Yes, other ways to help a gassy baby feel more comfortable include burping often during feedings, keeping your baby upright for at least 30 minutes after each feeding, and avoiding too much stimulation around mealtime. If possible, try to avoid having other people in the room when bottle feeding. This can be very distracting for babies who are already feeling uncomfortable from gas. Finally, you may want to consider switching to an anti-colic formula or bottle type if your baby seems extra sensitive to gas. Remember that all babies are different, and that some of these tips may not work for every infant, but with a little trial and error, you'll soon find the best way to help your own gassy little one. 7. Is it okay to give my baby gripe water or other natural remedies for gas pain relief? Most parents agree that natural remedies such as gripe water can be a lifesaver when it comes to soothing a gassy baby. These remedies are usually safe and effective, so they are worth considering if your little one is suffering from gas pain. However, make sure you consult with your pediatrician before incorporating any type of new remedy into your baby's diet. Some of these products may contain ingredients that could be potentially harmful to babies, such as certain herbs or essential oils. It's always better to err on the side of caution. We hope this video has provided you with helpful tips on how to reduce your baby's gas pains while bottle feeding. Remember, it is important to position the bottle correctly and feed slowly in order to prevent air from entering their stomach. If you have any other questions or would like more information about reducing gassiness during bottle feeding, please leave a comment below. Don't forget to subscribe for weekly videos full of parenting advice and tips. Thanks for watching.